It was the story that gripped the world. She became known as the Angel of Death and the Baby Poisoner, a woman of cunning and cruelty. According to a childhood friend, it was Lucy Letby's dream to become a nurse and look after babies. But last year, the unassuming 33-year-old was convicted and sentenced to 15 life prison terms for the murder and attempted murder of 17 newborn babies in the neonatal ward of the Countess of Chester Hospital in England. Now, a panel of experts from across the world have issued a report. They're finding that there's no medical evidence to support her convictions and the babies suffer deaths from, quote, natural causes or errors in medical care. Dr Neena Modi is Professor of Neonatal Medicine at Imperial College London, and she was part of the expert review panel that's issued this report. Dr Modi, welcome to the Radio National Hour.
Thank you very much.
Your report, the report from the panel, has examined the cases of 15 babies who either died or fell gravely ill, and according to the court finding, the conviction, by the hands of Lucy Letby. In every single case, your expert panel found there was clear medical explanations for the babies' deaths. Did this come as a surprise to you, given everything that was reported about this case at the time?
So we examined 14 cases. And as you say, we found no medical evidence other than that these babies had died or deteriorated because of natural causes, sometimes compounded by a failure to recognize the problem or to treat the problem adequately. You ask whether it came as a surprise. I think there has been considerable discussion of this case over the years in the UK press, and it's certainly the case for those of us who reside in the UK that there had been a growing sense of anxiety and unease. But of course, I had not seen the full details of the cases until I was formally instructed and the full paperwork was revealed to us. When we did see that, it was quite striking, and we were shocked by what we saw.
So can you just tell me briefly a bit about the panel and what you did see? Who constituted the panel in broad terms, and what you were able to examine?
So the panel were comprised of 14 very experienced, very senior neonatologists from around the world. So we've got folk from the UK, Canada, the USA, Germany, Japan, India. As I say, experienced neonatologists from around the world. We have been formally instructed by Lucy Letby's current barrister and solicitors, and so we were given access to all of the papers that formed the trial proceedings.
And when you and the others examined it for you, let's talk about your experience, was it clear to you, was it very evident to you that there was a case of, the babies dying or deteriorating by natural causes? Was that very obvious to you as you looked at
Yes, it was.
The description of what happened?
It was clearly every case was different.
Sure.
And some were much more striking than others, but it's certainly the case for all of them. And the ones that were most striking were particularly anxiety-raising, because we wondered how the prosecution experts could have failed to draw the conclusions that we drew.
Well, let me talk you through how they drew the conclusions they did. How do you explain the very specific allegations that were prosecuted and found to be true by the court, that Lucy Letby had injected air into their bloodstreams and poisoned them with insulin? These were delivered to the court as fact.
Well, what we discovered was that the evidence for air embolism was non-existent. It was supposition based on a record in the notes of discoloration of the baby's skin. Now, babies that are very, very unwell do have mottling of the skin in a variety of different circumstances. The post-mortem evidence of gas in the bloodstream is a well-recognized occurrence. The expert radiologist who appeared before the court said that he's seen this in about 25% of post-mortems of newborn babies, and it's usually attributable to the vigorous resuscitation efforts that take place prior to death. So it doesn't stack up that just because you see evidence of I'm just giving you one example, seeing gas in the circulation on post-mortem radiography, or that you see discoloration of the skin unspecified, that this equates to air embolism. There were much, much more plausible causes for these babies' deaths or deterioration than air embolism, which was a highly speculative suggestion.
Much more plausible causes. The allegation that Lucy Letby had injected children or the babies with insulin too is interesting. We spoke on Background to Professor Jeff Chase, who contributed to the expert panel review. He said that the elevated levels of insulin detected in the babies, the premature babies' blood, were in some cases within the expected range for preterm infants. If he knows this, and now we know this, how could this have been used as such incriminating evidence? Didn't the court hear the sort of evidence tendered that Jeff Chase has told us, Professor Chase?
So I think what your question's a very good one, and what it raises is how so-called expert witnesses are selected in cases such as this.
Mm-hmm.
And I don't know whether there is a discussion going on about this in Australia, but there certainly is in the UK. And that is that should there be better guidance, better standards, a better process, if you like, for how medical expertise and experience is judged when it's required in legal cases.
Have you, or I presume the panel wasn't in the remit of the panel, but have you looked at the expert evidence tendered and the experts who gave that evidence, and do you have any view or judgment on that?
We do, and we do, and clearly our view differs from that of the prosecution expert witnesses.
And your report goes into great detail about the medical histories of the babies, in some cases going to their condition in utero before they're even born. Can you just give us a sense of how sick babies are when they're admitted to this care unit, how stable premature babies generally are, and can they be well one moment and then very sick and even dying the next without some kind of, sinister
So
motive?
Babies are only admitted to a neonatal unit if they need over and above extra care. Any other baby would not be admitted to a neonatal unit. So de facto, by nature of being admitted to a neonatal unit, they are recognised as being very vulnerable, very much in need of continuous monitoring. And some of the babies in the Lucy Letby case were in this category. In other words, they were vulnerable and were requiring close and constant monitoring. Other babies were actually overtly unwell. So there were instances of babies who had clear signs of being unwell from the moment of delivery. As I say, there were 14 cases. They're all very different, but the overall conclusion is that to describe them as healthy, well, and stable babies is very misleading indeed.
You're listening to the Radio National Hour. My guest is Dr Neena Modi, Professor of Neonatal Medicine at Imperial College London. Professor Modi, your review found that inadequate staffing, resources and infrastructure deficiencies could be a contributor. Well, it certainly found that they existed at the hospital. Is it easier to blame one person than to fix the whole dysfunctional system? That is, did Lucy Letby, in other words, take the fall for a system in crisis? Is that your conclusion?
I don't think it's for us to draw a conclusion. That's the conclusion of a legal process. We are doctors, and our remit was to review the medical evidence and comment on the medical evidence, which we've done to the best of our ability. I think you do raise a very important point, though, and that is that when things go wrong, it's usually not a single instance of something going wrong. It's usually a culmination of a number of different errors coming together to create a very tragic outcome.
Another conclusion from the expert panel that you're a part of was, quoting here, there were problems related to teamwork and interdisciplinary collaboration at the Countess of Chester Hospital Neonatal Unit. What did you find? Why was this worth noting? This
is worth noting because any patient, and particularly a a patient who's very ill or who's got a very complex condition requires input from a number of different specialties, a number of different disciplines. One obvious example in the case of newborn babies is that obstetric and neonatal teams need to work closely together. That would seem, I think, to be self-evident to most people. So there are, for example, decisions to be made about whether or not babies who might be predicted to be in need of extra help should be delivered in a particular neonatal unit. Where you're predicting the high possibility of a baby needing really expert care, it is by far, around the world, it's by far the preferred option for the mum to be transferred before she delivers to what we'd call a level 3 centre. In other words, a centre able to provide the highest level of newborn baby support. So we raise that point because we don't know the answer to this, but we believe it's a question that needs to be asked, about the extent to which there was this discussion between, for example, obstetric and neonatal teams, and then the extent to which there was discussion between the neonatal teams and all of the other disciplines involved. Biochemists, pathologists, infectious diseases specialists, and so on and so forth.
In November of 2016, so this is some years before Lucy Letby was even arrested, let alone convicted, the Royal College of Paediatrics and Child Health conducted a study at the hospital, at the Countess of Chester Hospital, and found no obvious factors linking a total of 8 deaths in the neonatal unit in 2015 and 5 deaths up to July 2016. However, it did uncover significant gaps in medical competencies, insufficient staffing for the provision of longer-term higher dependency and some intensive care, and it also found the increased mortality rate at the hospital was not restricted to the neonatal unit, that stillbirths in the maternity ward were also elevated. Should that study have received more attention? And did you look at that study? Did you examine that study too, as you did your assessment?
So we did not. So that I was actually president of the Royal College of Paediatrics and Child Health when that review was done, but I was not privy to the results of the report because these reports are confidential, and their outcomes are known only to the study team. They're not shared widely outside of that team. So they would have been known only to the team conducting the review and the Countess of Chester Hospital, who would have been receiving that report. So I don't feel I'm in a position to comment on your question any further there. I am not speaking in any way at the moment as a past president of the RCPCH. I'm speaking as a neonatologist.
I understand that, though, but on the one hand you have that report from the Royal College, and on the other hand you have the evidence which strikes me as having been relied on a lot, which was the circumstantial evidence that the fact that Lucy Letby was on shift when every one of these babies died or fell ill, and there was quite a famous police graph demonstrating this that seemed to gain widespread coverage and persuasion. What did you think at that time when you saw that? Presumably you saw that. Was this cluster that unusual, or Lucy Letby's presence on the ward too much of a coincidence, did you think?
Well, again, this is not an area that falls within our remit or our expertise. This is the issue of the statistical evidence. And you will, I presume, know that there has been discussion by a number of senior statisticians as to the validity of that evidence, but it would not be appropriate for me to comment on that as I am not a statistician.
Now, I may get the same answer this time, but let me ask you anyway, because I'm very interested in your opinion on the inquiry into the Countess of Chester Hospital conducted by Lady Justice Catherine Thirlwall. In her opening remarks last year, she explicitly said that this was not about reviewing the convictions. In other words, she was not open to the possibility that Lucy Letby might have been innocent. That was not under her remit, might not have been the cause of the baby's deaths. In your view, is that an appropriate way to begin an investigation into hospital practices and possible failures that may have contributed to these deaths?
So I'd like to say 2 things there. First of all, again, it's not for me to comment on the remit of Lady Justice Thirlwall's inquiry, but I can say from that there is an opportunity I'm not saying to overturn or to question the verdict of a previous court, but there is an opportunity to unearth evidence that perhaps should have been presented to the jury, but was not. That is part. I'm happy to stand corrected here, but my understanding is that a public inquiry's remit is to try and elicit pieces of information that might not have previously been reviewed or been made available. So I think this is an opportunity to actually unearth some of the evidence that should have been presented but was not.
Well, the Letby case is now with the Criminal Cases Review Commission, so it will be considered. I'm not sure if the thorough inquiry is still going on, but do you think your expert report should be tendered to it? And what outcome would you like to see come from your investigation into the neonatal wards in the hospital now that it's with the Criminal Cases Review Commission?
Well, our draft report is now out and in the public domain, as you know. Our full report will be submitted to Lucy Letby's legal team in the near future. Afterwards, it is up to Lucy Letby and her legal team to decide to whom they wish to make that full report made available.
There have been several other comparable cases of nurses being convicted in the Netherlands and in Italy, quite two high-profile ones. Do you think, from your experience, Dr Modi, that neonatal cases are more highly scrutinised because of the age and vulnerability of the patients and more charged with emotion?
They're certainly charged with emotion because this is a very emotional area. I would say that's the case, though, for anybody dying in hospital where there seems to be uncertainty about the cause of death. But I'd also say that, as you've just mentioned, there are clear cases of miscarriages of justice. So I think it behoves all of us to have open, not closed minds, and to be open to new evidence and new interpretations, and be willing to listen to these new pieces of evidence as and when they arise.
And now, are you certain and are you prepared to say that you think that the convictions against Lucy Letby were a miscarriage of justice?
What we're saying very clearly is that in each of the 14 cases we examined, there were highly plausible, much more likely causes of death than malfeasance.
Dr Neena Modi, thank you very much for joining me on the Radio National Hour.
My pleasure. Thank you very much indeed for having me.
Stream any ABC radio station live.